Hi everybody, my name is Fairly Mendoza. I'm a community health nurse at Symptom Health Center, Cowichan Tribes. I'm here today because I want to thank you all, Haitsapka, for your efforts to slow down the spread of the COVID-19 illness. As you know, this illness has been in our community for a number of weeks now, and our health system is coping with it. Our hospital system is working, and that's thanks to you. COVID-19 illness is caused by a virus that's new to us. It's now spread all over the world, and it's a very serious, highly contagious virus. We know that some of us will acquire the virus and have no symptoms and no illness signs at all, yet we can still pass it to others. Most of us will have a mild illness, like a flu or a common cold, but some of us will become seriously ill and require hospitalization. Those of us who are over 50, those of us who have underlying conditions like diabetes, high blood pressure, we have lung conditions such as asthma, or we are smokers. Some of us are taking medications for conditions that make our ability to fight disease more challenged. Some of us had cancer treatments. Some of us have had organ transplants. We are all very vulnerable to the serious side of COVID-19 illness. And most of all, those who are most vulnerable, most fragile, are our community members who we love, our elders. Those 70 and 80 years old are very vulnerable to this illness and must be the most treasured and protected members of our community. So, what are we doing? For several weeks now, we've been doing hand washing. Hand washing is well proven to reduce the spread of many germs, including COVID-19. We're asked to wash our hands 10, 20, 30 times a day, and washing them well for 20 seconds with soap and water through the fingers, over the hands, the nails, the thumbs, the wrists. We are teaching our children and our family members to practice this vital step. What else are we doing? We don't touch the face, particularly nose, mouth, eyes, because that is the route into our body. Thirdly, we do not cough or sneeze into the air. We know that 6 feet away is a safe distance. That's about a picnic table length away from another person. But if we are discharging with a cough or sneeze, it could be longer than that. So we use our elbow or a tissue, which we throw away and then wash our hands. More difficult than this is the practice of social distancing. We have been asked for several weeks now to stay home with our family members, our immediate household members only. Only go to work or to the store if necessary. And when we do go to the store or go to work, we keep 2 meters or 6 feet distance from others. And if that is not possible, it is best to wear a homemade mask. That is a cloth mask to cover your mouth so that you don't infect anybody else. If many of us are wearing the masks, it will reduce somewhat the risk of transmission. So with that said, some of our family members, particularly our elders, as I said, are more vulnerable, and we should not be visiting or going in their homes. We should be calling them every day. We should be doing your grocery shopping and errands for them so that they do not have to leave and expose themselves to this risk. This is working. I really encourage everybody to take it seriously and keep going. We are told by the Premier, or Prime Minister rather, yesterday, Justin Trudeau, that this period of restrictions is going to last several weeks, if not months, because it is slowing down the number of infections and thereby the number of deaths that could occur if we don't stay home. Lastly and importantly is if you feel ill, any kind of illness symptom, to be very careful to stay home and not go out at all. Usually, COVID-19 illness is a cough, fever, fatigue, and headache, but other symptoms such as abdominal pain, fainting, other kinds of things have happened first. So if you are sick, please do not go to work, do not go to the store. You must call doctor or 811 to determine if you need to be tested. And in your home, if you can stay in your own room and clean up after yourself well in the bathroom, this will help reduce the risk to other family members. Any questions, please call the nurses at Symptom Health. We want to help you. We are here all working full-time to protect our community. We also have a virtual doctor clinic, many clinics online, and as I said, 811 is a very good go-to number. Also, for those of you who are suffering depression and isolation because of this problem, we do encourage you to reach out to each other and also take advantage of our counselors who are also here working for you every day. So going into the holidays this weekend, our Chief Public Health Officer, Teresa Tam, has asked us to please limit our family celebrations to our households. Do not have large family gatherings. Do not visit each other in person. To reach out in all the other ways. But we are really, really fortunate that thus far we are managing this pandemic, and I ask everybody to take care and stay home. Lights up.